What are STI risk factors after a negative test? Even after receiving a negative test result for sexually transmitted infections, there are still factors that can increase your risk of acquiring an STI. It's important to understand that a negative test reflects your status at the time of testing but does not guarantee future protection. One major risk factor is having new or multiple sexual partners. Each new partner can introduce their own risk profile, and STI transmission can happen if they are infected but undiagnosed or untreated. Another significant factor is inconsistent or no condom use. Not using condoms consistently during vaginal, anal, or oral sex raises the chance of STI transmission, especially with partners whose STI status is unknown. If your partner has other sexual partners or has a known STI, your risk also increases. This is particularly true if those partners remain untreated, as reinfection can occur. Age plays a role too. Young people under the age of 25 are at a higher risk for STIs like chlamydia and gonorrhea due to a combination of behavioral and biological factors. Additionally, men who have sex with men have a higher prevalence of certain STIs, including HIV and syphilis, which raises their risk after a negative test. People living with HIV are also at increased susceptibility to other STIs, making regular screening and vigilance essential. If you have a history of previous or concurrent STIs, this indicates a higher vulnerability and may suggest that risk behaviors could still be present. Engaging in high-risk behaviors, such as exchanging sex for money or drugs, illegal drug use, or having a history of incarceration, is also associated with a higher risk of STIs. Furthermore, living in areas with high STI rates can increase your likelihood of exposure. It's also crucial to consider the timing of your test. STIs may not be detectable immediately after exposure due to incubation or window periods. Testing too soon after exposure can lead to false negative results. After a negative test, it's important to continue practicing safer sex methods. This includes consistent condom use, limiting the number of sexual partners, and regular STI screening, especially if you identify any risk factors. Retesting is recommended if you have a new partner, develop symptoms, or within 3 months after treatment of a prior infection to catch any reinfections or new infections early. In summary, a negative STI test result is just a snapshot in time and does not eliminate future risk. Being aware of these risk factors and maintaining ongoing preventive measures are essential for your sexual health and reducing the likelihood of acquiring STIs after a negative test. Always consult with healthcare professionals for personalized advice and guidance.